Hi students, this is me Dr. Aditya once again. As you know that in my videos I prepared you for your USMLE as well as PLAB and NCLEX examinations. Today I have come up with a very important topic, that is defense mechanisms. Often in USMLE examinations you see the questions framed like they describe the scenario of some of the eco defense mechanisms, and then you have to identify which eco defense mechanism is the person using in that case, especially USMLE step 1. We'll try to understand what are the different immature and mature defense mechanisms, and then there are some confusing ones. We'll try to deal with them, and I promise you, once you go through this video, you find this topic very easy, even if you are in the medical school or nursing school at the moment. And so let's go ahead, and I'll try to since there are lots of almost 20 slides here, so I'll try to really go quick. Okay, so let's do it. So defense mechanism, there are immature and mature defense mechanisms, and then we are going to deal with all of them. Let's see. So ego defenses. What does ego defense mean? So the thoughts and behaviors, that is voluntary or involuntary, used to resolve the conflict and prevent undesirable feelings, that is anxiety or depression, is ego defenses. This presentation covers 16 immature and 4 mature defense mechanisms. So the one of the immature defense is acting out. So the description is a person subconsciously copes with the stressors or emotional conflict using actions rather than reflection or feelings, and this is called as acting out. Example, a patient skips therapy appointment after deep discomfort from dealing with his past. So here the person, rather than showing expression or reflecting on the feelings, he chooses to take an action, that is skipping the appointment. Okay, so this is an example of acting out. Similarly, there are other examples, like a teenager who is angry at his parents, storms out of the house and gets into a fight at his school. Since he was angry, he acted out and stormed out of the house and get fight in the school. So this is another example of acting out. Another is a patient who feels anxious about a diagnosis, abruptly leaves the doctor's office mid consultation. So this is another example. Now, denial. This is another immature defense mechanism. In this, the person avoids the awareness of some painful reality. So example, a patient with cancer plans a full-time work schedule despite being warned of significant fatigue during chemotherapy. Just look at this guy. He is in the hospital. Let's say he hasn't been diagnosed with cancer, but he is in denial. So he is carrying on with his full-time work schedule. There are other examples, like a heavy smoker insists that smoking has never harmed anyone in his family, so it must be fine, and so he keeps on smoking. Next is a grieving widow continues to set the table for her deceased husband every evening. So here, although the widow's husband is dead, so she is still in denial and sitting at the table for the dinner, okay, for her husband too, who is dead. Next defense mechanism is displacement. It means that redirections of emotions or impulses to a neutral person or object. Okay, so we often confuse this with projection. I'll deal with that later. So example is that after being reprimanded by principal, a frustrated teacher returns home and criticizes wife cooking instead of confronting the principal directly. So in this case, a teacher is being reprimanded by the principal, so instead of dealing with the principal in the school, goes home and to the neutral subject or the person, here let's say wife, he starts criticizing his wife's cooking skills. Rather, he could have talked to the principal in the school itself, right? But rather he chose to bring up the topic and outpour his anger or frustration to his wife. So in this case, this is called as displacement, because the wife is a neutral subject. So the emotions is flowing from one place with regard to one person to the another place, and another person which is often neutral. Okay, his next example is the student who is angry at her professor, comes home and snaps at her younger sibling. Next is a man frustrated with his boss, kicks his dog when he gets home. Another examination of immature difference is projection. So description is attributing an unacceptable internal impulse to an external source versus displacement. So we often confuse between this displacement and this projection. So let's first deal with the projection. So in projection, what you have to remember is that you feel your wife is cheating you. Okay, in fact, you want to cheat your wife, but you project the relationship in such a way that you make the wife think that, hey, you are cheating me, but in reality you are trying to cheat. Okay, this is something like that. So attributing an unacceptable internal impulse to an external source. Okay, now example is a man who wants to cheat on his wife accuses his wife of being unfaithful. So this is projection. He wants to cheat, but he's feeling discomfort with that feeling that, okay, he's cheating someone, but now he projects that thought on his wife and saying that, hey, you are trying to be unfaithful to me, where indeed he is the one who is developing such thoughts. So this is projection. Next, another example is a student who hasn't studied accuses classmate of cheating when they score higher. Next is a person who harbors racist thoughts accuses others of being prejudiced against him. So this it is one example. Let's compare and differentiate displacement versus projection. In displacement, emotion is owned by the person and is redirected to a neutral or safe target. No denial of the feeling. Okay, example, teacher real side of wife after being scolded by principal. And in projection, emotion is denied and attributed to others, accuses another person of having the feeling, involves in distortion of reality. Example, man who wants to cheat accuses his wife of being unfaithful. So key distinction is that in displacement, I feel it but take it out elsewhere, but in projection, I don't feel it, you'll feel it. Okay, it's somewhat like that. So you have to understand the differences. Next dimension difference mechanism is dissociation. Dissociation is that a temporary drastic change in personality, memory, or consciousness or motor behavior to avoid emotional stress. Okay, and patient has incomplete or no memory of traumatic event. This is important. The patient has incomplete or no memory of traumatic event, and in this case, the person there will be temporary or drastic change in personality, memory, consciousness, or motor behavior to avoid the emotional stress. Let's say example. So another in the example of dissociation is a survivor of sexual abuse sees the abuser and suddenly becomes numb and detached, like this person. A soldier who witnessed combat describes the event in a detached, robotic manner, as if recounting someone else's story. A victim of a car accident cannot recall the movements of the crash despite being conscious thought throughout. Okay, so this is dissociation. Now another is isolation. We also call isolation of affect. So in this case, there is a separation of feeling from ideas and events. Okay, this is and the defense mechanism isolation, and we often get confused with dissociation. So let's first go with isolation, and then we'll try to differentiate between dissociation and isolation. Example of isolation is describing murder in graphic detail with no emotional response. Suppose you were a bystander where the murder took place in the street. Now if you are describing to the police with no emotional response, then that is isolation. A surgeon calmly describes, because a surgeon is used to operating thousands of operations, right, throughout the life. So a surgeon calmly describes performing a difficult operation on a child without saying any emotional distress. That is isolation of affect. A person recounts being mugged in a flat matter of fact tone as though reading a news report. Okay, these are the examples. Now let's see the difference between isolation of affect versus dissociation. In isolation of affect, as we said right now, it's a immature defense mechanism. Emotion is separated from the memory thought. Memory remains intact and accessible. So the surgeon is talking about the surgery in detail, but he's not showing any emotions. So the memory is intact and accessible. Okay, but just the emotion is separated. So this is isolation of affect. Person recalls the event but feels nothing about it. Conscious awareness of the event is preserved. Example, a surgeon calmly describes a traumatic operation without any emotional distress. But in dissociation, like we said, that a person suddenly becoming numb when see his abuser in front of him. So in this case, in case of dissociation, this is also an imaginary defense mechanism. The memory is completely detached or lost. Okay, the memory may be absent or fragmented. Okay, person may have no recollection of the event. So in isolation, person has memory. In dissociation, the person doesn't have memory or is just fragmented. Okay, in isolation, just there is the separation of emotion, but in dissociation, there is no memory, so the person becomes numb. Okay, Okay, in dissociation there is involvement of altered consciousness or identity. Example is again a survivor of abuse is the abuser and suddenly becomes numb and detached with no memory of what happened. Key distinction: isolation of effect, remembers the event but feels nothing. In dissociation, memory or identity itself is disrupted or lost. Next mechanism is fixation. In fixation, partially remaining at a more childish level of development, but okay, this is fixation. We get confused with regression. We'll talk it after this slide. An example of fixation is a college student continues to suck her thumb when studying for stressful examinations. So she was in the habit, she never quit this habit of sucking her thumb throughout her school days, and now since she's also in the college, she's still been sucking her thumb in the stressful examinations. So this is fixation. Next is a 35-year-old man still relies on his mother to make all his decisions, never having developed autonomy. An adult who was orally fixated as a child becomes a chronic overeater or heavy smoker. Okay, these are the examples of fixation. Next is regression. Regression is involuntarily turning back the maturational clock to behaviors previously demonstrated under stress. Okay, example is a previously toilet-ridden child begins bedwetting again following the birth of a sibling. Now, after the birth of the sibling, the child has developed some stress because maybe their parents are not giving enough time that they used to give to them. So because of this stress, now although he had stopped bedwetting, now he is back to bedwetting. So this is an example of regression. Another example is an adult throws a temper tantrum and cries uncontrollably after losing a board game. Next is a previously independent college student starts calling their parents multiple times a day after a difficult breakup. Okay, now let's differentiate between fixation and regression very quick. In fixation, there is never fully progress past an early stage. So that lady, the student, she had a habit of sucking her thumb in the stressful situation throughout her life, and she is even continuing at her college days. So that is fixation. Ongoing present throughout the development, behavior was never outgone, and example is called the student who never stopped sucking her thumb. In the regression, it had progress but reverts under the stress. Episodic, it is triggered by stress. Behavior was outgrown and then returned. Example is toilet when a child starts bedwetting after a new sibling is born. Okay, key distinction is fixation never left the stage and regression left the stage but came back. Next, and immature defense mechanism is idealization, and description is expressing extremely positive thoughts of self and others while ignoring the negative thoughts. That is idealization. Example is a patient boasts about his physicians and his accomplishments while ignoring any flaws. A new employee views their manager as a perfect infallible leader and refuses to acknowledge any of their flaws. A teenager idealizes a celebrity and believes they can do no wrong despite evidence to the contrary. Next is identification. This was idealization, and now next is identification. In identification, the description is it's largely unconscious assumption of characteristics, qualities, or traits of another person or group. So in identification, the person tries to copy some other ideal figures. So that is identification. Whereas in idealization, the person just thinks that particular person is completely Mr. Perfectionist, like I mean, is completely perfect person and has no flaws. That is idealization. But if you try to copy others, and that is the role figures, and that is identification. Let's say example of identification. A resident starts putting her stethoscopes in her pocket like her favorite attending instead of wearing it around her neck like before. A child of an alcoholic patient grows up to become a substance abuse counselor, identifying with the role of the helper because he had been seeing the counselor helping his father get away from the substance abuse. So now he thinks, okay, that counselor is very good role model in the life, so I want to become more like him. So now starts copying the counselor. So that is identification. And next is a bullied student begins to mimic the mannerisms and speech of the popular students to feel a sense of belonging. Okay, next defense mechanism is intellectualization, using facts and logic to emotionally distance oneself from a stressful situation. Example, a patient diagnosed with a cancer discusses the pathophysiology of the disease. Now he's more into books rather than dealing with, oh my god, I got the cancer, and getting frustrated. He started reading books, understanding the pathophysiology of the disease. This is intellectualization. A grieving widow immerses herself in researching the statistics of widowhood rather than processing her grief. A person who has just been diagnosed with terminal illness spends hours reading clinical papers about the disease instead of talking about their feelings. Next defense mechanism is passive aggression description, demonstrating hostile feelings in a non-confrontational manner, showing indirect opposition. Example: a disgruntled employees are repeatedly late to work but won't admit it as a way to get back at the manager. Suppose a manager has been harassing, or let's say has not been so good with one of the employee, and then the employee cannot confront the manager, but rather he's starting coming late for work. So this is passive aggression. A student who resents a teacher consistently forgets to submit assignments on time. A spouse who is unhappy in a marriage repeatedly agrees to plans and then cancels at the last minute without explanation. So these all are passive aggressions. Next is rationalization description, asserting plausible explanations for events that actually occurred for other reasons, usually to avoid self-blame. Okay, this is rationalization. Example: an employee who was recently fired claims that the job was not important anyway. So this is rationalization. He got fired. That job was indeed important for him, but just to avoid the self-blame, he is just taking it that, okay, that job was not important to me anyway, so I just got fired. I have no problem with that. So this is rationalizing the thing. Okay. And next is a student who failed an exam blames the teacher for writing unfair questions rather than acknowledging the lack of preparation. A person who cheated on their partner justifies it by saying the relationship was already over anyway. Next defense mechanism is splitting, believing that people are either all good or all bad at different times due to intolerance of ambiguity, common in borderline personality disorder. Borders split count is this is worth remembering. Okay, so splitting is a defense mechanism that is seen in borderline personality disorder, in which the person think that they are either the person is totally good or totally bad, so they just to avoid the discomfort of ambiguity. And this line, borders split boundaries, this is to remember that in borderline personality disorder the defense mechanism is splitting. This is often asked in examinations. Example: a patient says that all the nurses are cold and insensitive but the physicians are warm and friendly. This is splitting. A patient with borderline personality disorder idealizes their therapist 1 week and then declares them the worst therapist in the world the next after a minor disagreement. Next, again, a child of divorce sees one parent as entirely good and another as entirely evil, unable to hold a nuanced view of either. So this is splitting. Next is repression, immature defense mechanism. Description is involuntarily withholding an idea or feeling from conscious awareness. Okay, this is repression, involuntarily withholding an idea or feelings from conscious awareness. So he is trying to forget the things, but in fact he's not trying, it's already forgotten involuntarily. If some things from the memory is from that any traumatic event is forgotten automatically without, I mean, let's say involuntarily, then that is repression. If something from the memory, that the harsh thing from the memory gets erased automatically from the memory, then that is repression. Okay. Example: a 20-year-old does not remember going to the counseling during his parents divorced 10 years earlier because this was a tough situation to him, so involuntarily he forgot the thing. So that is repression. A woman has no collection of being abused as a child despite it being confronted by family members. A soldier returns from war with no memory of a traumatic event that his fellow soldiers clearly recall. Next immature defense is reaction formation. Description is replacing a worded of idea or feeling with an emphasis on its opposite. Okay, so example: a stepfather treats a child he resents with excessive nurturing and overprotection. This is reaction formation. So replacing a worded of idea or feeling with an emphasis on its opposite. So he doesn't like his stepson much. Okay, stepfather doesn't like his stepson much. So instead of dealing with that negative feeling, he overtly start caring and overtly start nurturing it. So that is reaction formation. A person who is deeply attracted to someone they shouldn't be becomes excessively cold and hostile towards them. Okay, a politician who privately holds corrupt IPOs campaigns loudly and aggressively against corruption. This is reaction formation. They know they are doing corruptions. That is a wrong thing. So instead of dealing that, okay, I'm doing something wrong, they rather campaign loudly and aggressively against corruption. So this is reaction formation. Next is sublimation. Dispersion is, this is now from here the master defense mechanism starts. Okay, there are 4 master defense mechanisms we're going to talk here in this slide. This is sublimation, altruism, and the next will be suppression, and next will be humor. So let's deal with them very quick. So sublimation, this is a master defense mechanism in which replacing an unacceptable wish with a course of action that is similar to the wish but socially acceptable. Okay, so example, a teenager aggression towards her parents because of their high expectation is channeled into excelling in sports. So this is sublimation. A person with strong violent urges become a professional boxer, channeling aggression into sports. A man with repressed sexual impulses becomes a prolific and celebrated artist. So in this case, what is happening is that this is a master defense mechanism. A person is replacing an unacceptable wish. So let's say he was always combative in all his life. He has conduct disorder, and when he grew up, he knew that the society will not accept him as someone who is into breaking the things. But then he chose to become a professional boxer. So that's why as a boxer, everyone respects in the society, where he can do some of these things like breaking the things, but in a good and socially acceptable way. This is sublimation. Okay, he replaced some unacceptable wish with a course of action that is similar to the wish but socially acceptable. This is sublimation. Next is altruism. In altruism, elevating negative feelings by unsolicited generosity which provides gratification. Okay, example, a mafia boss makes a large donation to charity. Okay, this is altruism. A person who feels guilty about their wealth anonymously funds scholarship for underprivileged students. Or recovering alcoholic volunteers at a rehabilitation center to help others, elevating their own guilt. So now let's differentiate 3 things: reaction formation versus sublimation versus altruism. Reaction formation is a mature defense mechanism, whereas sublimation and altruism were mature defense mechanism. In reaction formation, replaces feelings with its just opposite, and the behavioral is exaggerated, and reverse example is resentful stepfather becomes excessively nurturing. This was reaction formation. In sublimation, it was massive defense mechanism, channels impulse into socially acceptable actions similar to original wish. Productive, the outcome is there. Example is aggression channeled into competitive sports, like a person wanted to become a boxer. That is sublimation. In altruism, massive defense relieves negative feelings through unsolicited generosity. There's something donation like thing, that is altruism, gratifying to self and helpful to others. Example, mafia boss donates to charity. So key distinction is in reaction formation, the person reverses, it's an immature defense mechanism, the person reverses the feelings. So he was not feeling good about the stepside, but still he now is doing over nurturing. So that is an over protectionism, that is reaction formation. In sublimation, it redirects to the mature and socially acceptable form. So he wanted to be, he turns to be a boxer. In altruism, he relieves through giving, he donates. So that is altruism. Next is suppression. This is again a mature defense mechanism. Description is intentionally withholding an idea or feeling from conscious awareness versus reflection, which is temporary. We'll deal with compare this later. Example, an athlete focuses on other tasks to prevent worrying about an important upcoming match. In this, the person is intentionally withholding an idea or feeling from conscious awareness. So the athletic had a very important match upcoming. So instead of worrying about the match, thinking about the match and the opponents and everything, he starts watching TV. So that is suppression. He is voluntarily suppressing the ideas and the discomfort of thoughts related to the upcoming match. So that is suppression, and it is a mature defense mechanism. A medical student puts aside their anxiety about a difficult patient case to focus on completing their rounds. A patient sets aside their personal grief to remain emotionally present for their children during a family crisis. These all are examples of suppression. Let's compare repression versus suppression. In repression, that was a major defense mechanism. Involuntary, person is completely unaware. It was permanent or long-lasting. Person has no insight into the memory access. Example, 20-year-old has no memory of attending counseling during parents' divorce. This was repression. Versus in suppression, this is a major defense. Voluntary, person is fully aware, temporarily conscious. it is consciously set aside. Person has insight and knows the feelings exist. An example is athletic focuses on training to avoid worrying about an upcoming match. Key distinction between repression and suppression: repression is unconscious and involuntarily, it is a massive defense mechanism, whereas suppression is conscious and voluntary, that is massive defense mechanism. Remember, we talked about this repression few slides earlier in here, okay, where a 20-year-old does not remember going to counseling during his parents' divorce 10 years earlier. So this was repression, and we compared this repression with repression was involuntarily erasing some harsh thing from the memory, whereas in suppression, voluntarily putting aside the stressors away from the memory. Okay, and then we are almost towards the end of the slide. This is the humor. This is the last slide. Humor is a descriptions light-heartedly expressing uncomfortable feelings to shift the internal focus away from the distress. Example: a nervous medical student jokes about the boards. A cancer patient makes light-hearted jokes about chemotherapy side effects to cope with the fear of treatment, and a soldier uses dark humor with fellow troops to manage the psychological stress of combat. This is an example of humor where although you are feeling something bad, but you try to laugh off the situations. So here in this way, in this presentation, although it went up to 25 minutes and maybe 1 or 2 more minutes, but this was very important from examination's point of view. I think that if you could once through this again or revise very quick or just have a glance, then you will be able to solve most of the questions in your examinations. The questions, they will try to depict the scenarios, and you have to identify which defense mechanism they are using. Okay, and they often you often in the examinations make it confused if you do not revise well between repression and suppression, between reaction formation, sublimation, and altruism. Altruism is very frequently in the examinations, and also splitting for borderline personality disorder. And next is you get confused with fixation versus regression. So go through this once, and I hope you'll do very, very good in examinations. And also isolation of affair and dissociation. These are very important topics. Okay, go through it, and I'm sure that you'll succeed in examinations. Okay, you often get confused with displacement and projections. Once again, revise this. This is important. Okay, displacement to the neutral subject and projection. Just you don't feel you want to cheat, but you are saying, hey wife, you are cheating to me. That is projection. Okay, with this I'd like to end this video, and we'll meet again in next video. If you are revising, just increase the speed to 2 and just go through the slides, and I hope you'll do very well in the examinations. Best of luck. Bye bye. See you in the next video.